I wonder if you might have any advice, any words of comfort or reassurance for anxious, pregnant women out there who are listening to this right now.
I think the key things are that pregnant women are not appear to be at increased risk. If you do get the infection, most people recover safely, well. A small portion of women get sick, but even those women recover and do well. We are not seeing a huge impact on babies. We're not seeing a huge impact on pregnancies. And we are doing the very best we can with the most up-to-date knowledge in order to make sure that we keep moms and babies safe no matter where they have their care. And so I would say, yes, it's an anxious time, but know that we are on top of it and doing the very best that we can to keep you safe.
I wonder if you see a toll being taken on your patients in terms of stress right now. How are they feeling?
Absolutely. I think, at the best of times, having a new baby, particularly if it's your first baby, is a whole new experience. It's scary. It's new. You're learning new things. You're delivering a baby. That baby's learning new things. So it is a stressful and anxious time. There's a significant risk for postpartum anxiety and depression. But when you put now a new mom with a new baby in isolation, that magnifies the impact of stress and anxiety. There isn't that community to help support that mom. There isn't the mom groups. There isn't the breastfeeding classes that you can visit, which becomes sort of a social network of support. So that certainly makes people anxious and nervous. You think of a new mom with a new baby, she's breastfeeding, she's up every 2 to 3 hours caring for babies. The sleep deprivation at the best of times can be stressful, but to do that in isolation is even more stressful. We often look to our moms or our friends or our sisters for support when we have a new baby, and that's not going to be able to happen as easily. We usually think of having a baby as a very joyous time, but these women are certainly feeling that stress and anxiety, and I feel for them. When I had my first babes, it was stressful. Even though I'm in the business, it still felt stressful. So I can recognize and understand how uncomfortable moms must be feeling.
Absolutely. And it's really sad to think that there are a lot of grandparents who also won't necessarily be able to meet their grandkids, even just for a little while. Though I will say the best piece of advice, this is my first baby, the best piece of advice that I've received from a very good friend of mine is perhaps this is your very first lesson in needing to lose a little bit of control, because this is just an entire lifetime of realizing that you're not really in control.
Yes. Yeah, parenthood is a balance of trying to keep one step ahead of those kiddies. But certainly, yeah, it's a unique time. I think the advantage of social media in this situation is that there are alternatives for family members to meet the new baby between FaceTime and Skype and Zoom and all these different opportunities, and being able to take pictures and transmit them from cell phone to cell phone. I think that's helpful. We didn't see that in SARS. We've not seen that in the past. But the alternative is every time you pick up your phone, you go on Facebook or you go on Instagram, and you're bombarded with information. And sometimes the way information is presented is a bit challenging. X number of cases and this many deaths. But they don't talk about how many people have recovered or how many people did well and didn't get sick from the virus other than mild symptoms. So we're overwhelmed by the negativity, and we're seeing it globally. So where social media creates a unity, it also creates, I think, an overwhelming presence of this pandemic in your mind and your heart. And it's hard when it's reinforced like that to not get overwhelmed by it. Even us as healthcare providers are feeling overwhelmed by it.